Hi, today I want to tell you guys about my oncology appointment. In doing some looking at my dates yesterday, I actually was diagnosed on November 5th, um, which makes my first oncology appointment November 17th. So not a super long wait or turnaround. Prior to my oncology appointment, um, kind of told all my siblings, my parents, our immediate family, and friends, and Deja. Um, and then Ryan and I, kind of once we dispersed the information, um, I probably fell into some pretty big anxiety. I am a very type A planner. I like to know what's happening, make a plan, and execute. And that's really how I manage situations. And so not being able to have that was um, a little challenging to me. So it was lots of just trying to practice taking care of myself and being okay with the unknown in the meantime. So um, on the way to our appointment on the 17th, Little Rock's about a 2-ish hour drive. Um, from our house to the cancer center. And so I know that Ryan and I had both kind of been dealing internally with our own anxiety, fear, worry, but we hadn't really, I think we were trying to look out for each other. Like I didn't want to say too much to Ryan because I didn't want him to be worried about what I was worried about. And and I think vice versa for him, like trying us both just trying to be strong. But so when we finally have that little over 2 hours in the car, we do a lot of good talks in the car, walking. So we were able to really sort through, I think, thoughts that were going around in our head, like what happens if I die? Um, what happens if we go in and they tell me this is all over my body? All of those things. Now, none of those things are happening. But of course, that's where your brain goes um, initially. And so Ryan and I were really able to sort through and talk through some of those fears and also having a plan. I remember on the day that I got my diagnosis and I was at Klark's office and Ryan was at work that day when they called me and said, "Hey, we have your results. Could you come in?" And um, I didn't want to distress Ryan. So I called my sister Christy, and Christy went with me. Um, and I remember basically the doctor saying, like, now don't Google anything. And we were in the car, and I mean, we maybe had been in the car 4 minutes. And Christy was like, "Kayla, you're not supposed to be Googling." And I was like, "I know, but I can't help it." Now, granted, I have limited my Google to the Mayo Clinic website only. Um, Dr. Oachoa has told me there's some other good websites that she also gave me, but since that appointment, I haven't felt the need to Google. But initially, I did some Googling. I did just kind of want to know what was out there, and really, because I was anxious, I needed to know my options, what was going to happen. Um, and so before going in, Ryan and I had already kind of looked at some of that stuff. So I think walking into the appointment that day, we both already kind of had it in our brain like, let's just have a double mastectomy and let's move on and be finished. Like, I want to not have to worry about this. I want to not have to stress about this. Um, it's just too much. Um, but of course, we get there and I'm really anxious and I'm talking really fast. And I come in and I have my notebook and I have all this list of questions. And there were 4 doctors that were with us. UAMS is I think a teaching hospital is what they call it. And so they had one, I'm going to mess up what his title was. But he's in the process of doing his rotations after he's finished medical school, and so he was there. And then there was a radiologist who was there just shadowing the oncology team that day to really understand what they do, um, kind of holistically with patients from start to finish. And then the oncologist, Dr. Yu, was there. And then later, Dr. Oachoa, who is my breast oncologist or my surgeon, um, was there. And so a team of really strong women and one gentleman that first day. And what was really fantastic was they spent 4 hours with Ryan and I. They answered every question that I had. They were very gracious. They gave me so much good information. And so I was really, really thankful and just have so much gratitude for the way that they cared for us that day, because walking in that appointment, Ryan and I were on pins and needles. And 4 hours later, coming out, driving to go get Mexican food, because that's what you do, we both had a sense of relief. So it was a really good appointment. So I'll tell you a little bit about the options that were presented to me, um, and kind of where that went. So I think the first thing that they talked about was um, kind of what they call three options. And so one is the lumpectomy, where they take um, the cancer out, but they conserve as much as possible your breast. So a lumpectomy, which doesn't end up being an option for me. Um, I'll talk about that in just a minute. And then a single mastectomy, I'm not real sure the medical term for that, or a bilateral mastectomy, which is the removal of the breast tissue on both sides of your body. Um, when we started looking at options, those were the three options. The initial option, the lumpectomy, if I would have chosen that, which again, that gets taken off the table at my radiology oncology appointment, but that would have had to have been followed by radiation treatments. And so, in meeting though with the radiation oncologist, Dr. Crownover, he let me know that my cancer spread. So its growth, even though my cancer is in very early stages, its size, its growth is large, kind of what they would consider large, at 5 centimeters. And so a lumpectomy is only available if it is under 3 centimeters in size. And so I wasn't able to do and go the lumpectomy route. Um, so when I started asking, like, why would you pick to do a single versus a bilateral mastectomy? The doctors really shared with me that your survival rates are really the same, whether you do one or two. So there's not going to be any change in sort of overall longevity versus the single or the double mastectomy. But if you choose the single mastectomy, or if I chose the single mastectomy, my journey may look a little different in regards to I may be back in that space again where I would have um, developed breast cancer in my left breast. And so, kind of for me, when I was thinking through my decisions, I thought about the after part and waking up and wondering if I still had the breast tissue on the left hand side. Um, because here's what I think was so dysregulating for me is that I have what I consider zero symptoms. I do not have a visible or physical lump um, or mass in my breast at all. I feel completely normal. I feel completely symptom free. Um, I don't have pain. Basically, there was no outward indicators that I noticed or changes in my body that I noticed that led me to know that there was something wrong. It was just really from my mammogram, that I was able to detect this so early. So when I was thinking through my decisions and I was wondering about how how am I going to feel waking up every morning and going, am am I going to, am I developing cancer today? Um, and so that led me really to know that what was best for me was to go ahead and do the bilateral mastectomy, because it really reduces your risk that you're going to have to journey through this again. It's a really There's still a small amount of risk with a bilateral mastectomy, um, but I think I believe, if I'm saying it correctly, it's like 2 or 3% chance that I will have to go through this process again. But it was more about like a 25% chance, that I would have to go through this entire process again if I did not opt to do the left breast at the same time as doing the right breast. And so, feeling like I'm already having to go through this process, like, let's just kind of do it and be finished. So that is what I decided, is to do a bilateral mastectomy. And of course, I asked them, like, okay, can we do it next week? Like, I'll clear my schedule. This is fine. Um, and they have, of course, said no, that there's a lot of coordinating. I am also choosing to do reconstruction at the same time. So, of course, they have to coordinate the oncology team, and they also have to coordinate what they call the plastics team. And I don't love that word. And I'm going to, at some point during the course of my treatment, come up with a better word than the plastics. Um, so they have to coordinate both of those teams. There's also lots of things that I have to do in the meantime. I have to, of course, meet with all the people, and they also would like to do genetic testing to see if my cancer is genetic. The medical field has advanced, if I'm remembering correctly, that there's several cancers, especially cancers for women, that are genetically linked. And so, them wanting to be able to look at, is my cancer genetically linked, and should I also be considering some other preventative options, um, in case I'm going to have a high risk of having ovarian cancer or colon cancer and some of those things. So they also want to give me a little bit of time and space to really be able to consider my genetics report, and to be able to meet with the team about that as well. I do not have that back at this point. The additional thing that I learned that day is that my cancer is growing off of the production of my estrogen and my progesterone, so my hormones in my body. So on that day, they went ahead and prescribed me what is called tamoxifen, which is a medication that basically ceases the production of, or reduces, I don't know if it ceases or reduces the production of estrogen and progesterone in your body, therefore sending me into menopause. So I've been on that. In 3 more days, it'll be a full month. That has been, I mean, I've noticed a little bit of things, but it has not been an overall awful experience. But so in the meantime, that's sort of what we're doing to really reduce the risk that my cancer will continue to grow and spread. So kind of holistically, I'm feeling pretty good. I haven't picked up my Google medical degree anymore, just because I feel like the care and the information that I was given at my appointment was so thorough and so easy to understand, and it really quieted my mind. They gave me a really big breast cancer treatment book, which I assumed that I would sit down and read cover to cover, but I haven't even opened it. And I just feel like between the team of people that they have guiding my care, I feel so knowledgeable, and just haven't felt the need to pick that book up. Instead, I'm trying to spend my evenings just kind of taking care of myself. I've been doing a lot of coloring and a lot of staring at my Christmas tree. Ryan, with no complaining. Normally, he likes the Christmas tree to not be up until after Thanksgiving, but I love the ambiance and the twinkling lights of the Christmas tree, and so he did not even bat an eye when I put our Christmas tree up like 2 weeks before Thanksgiving. Um, So I've been trying to spend my evening reading fun things and just kind of taking care of myself in that way, because I think for me, if I'm not careful, my anxiety would spin maybe out of control. I am going to do a video kind of about my internal feelings and the experience, because I've done a lot of talking through the logistics and not so much of talking through the feelings. Um, Mainly, though, I'm really grateful. I mean, that's, I think, at the end of this where my biggest feelings lies. I just am intensely grateful for medical science, early detection, and the care that I have received is just astounding. And I'll put my care team in the show notes. I think I figured out how to do that on YouTube. I'm learning a little bit just so that people can see their names and know. I mean, I'm at I believe it's called the Winthrop Rockefeller Cancer Center at UAMS in Little Rock. Phenomenal care that I'm so, so thankful and grateful for. So I hope you have a great day. Um, Thank you for thinking about me. Thank you for watching this video. Bye.